Let's define what dry eye is. So dry eye is a condition where the eye doesn't produce tears properly. There are two systems that produce tears. One of them is called, am I squeaky? One of them is called a basal system, which means you produce minute quantities of tears all the time for 24 hours. And then there's sort of the reactive system, which could be crying in a movie, or you go outside in the cold wind and your eyes start to tear, and then you get a gush of tears. So there is a reactive system, and I'm squeaking. So why do we get dry eye? If the tears evaporate too quickly, then our eye's going to feel dry. In addition, if there's inflammation around the eye, on the lids, then the surface becomes drier. And we'll go into more detail how that occurs. Okay, so now we'll do some anatomy. Anybody here an anatomist, biologist, zoologist? Okay, so we'll talk a little bit about this, the anatomy of tear production. So if you look here at my pointer, you see the pointer? The main source of the tears are lacrimal glands, which sit in the upper outside portion of the lids, and we can't see them. So occasionally we will see them. That squeaking is going to kill me. Occasionally we will see them if they get inflamed, and you can actually get tumors in the lacrimal glands. There are certain generalized conditions which can cause swelling of the glands, but this is the major source of tear production. And as we get older, they become less efficient in producing tears. So tears are also produced by small tear glands along the lid margin. So this just gives you the anatomy, and I don't know if anybody's ever wondered where do tears go when we produce them. We don't get runoff usually unless we have a lid problem or a malposition of the lid. So there are two little openings called a puncta on the upper lid and the lower lid, and basically the tears, when we blink, the tears are forced into that, through that opening, goes into a little lake or lacrimal sac, goes into the nose, and then from the nose, it goes into the stomach and gets recirculated. So we are constantly recycling tears. And sometimes you can get tearing if any one of these areas are blocked. Did anybody ever have that experience where their tears are overflowing, or you've seen people walking around constantly blotting their eyes with a tissue? It means they probably have a blockage in this system somewhere between here and the nose. Okay, so as I talked about, there are two different systems of production. One is around the clock, and the other is reactive. And the tear film is very complicated. It's made up of three layers, okay? Lipid, which is fat. Okay, mucus, everyone knows what mucus is, right? And aqueous, which is almost like saline solution. And this just shows where each of these layers comes from. So the lipid layer, the fat layer, comes from glands behind the lashes called meibomian glands. The mucus layer is produced by the white part of the eye, by goblet cells, and the aqueous layer is produced by the lash. So these are the three layers. So if there's a deficiency in any one of these three layers, you're going to have dry eye. So our goal as eye doctors is to figure out which layer is problematic and then how to treat them. So, what are the symptoms of dry eye? It has a lot of different symptoms. Some of them you'll say, oh yeah, I knew that because I've had dry eye, or I have friends that have dry eye. They're always complaining that their eyes feel sandy and gritty, or they just have a heavy sensation. Anybody here have any of those symptoms? A little bit. And as you would expect, it gets worse as the day goes on. I see everybody concentrating, listening to me, and their eyes are wide open. So the more your eyes are open, the more likely the tears are to evaporate. And so that's why it gets worse as the day goes on. So sometimes we can diagnose this over the phone just by taking a history. So when do you think the symptoms would get worse? Summer and winter. Why would that be? Because you have extremes of temperature, right? You have either a lot of heat And then when your eyes dry out in the heat, you go, I gotta go inside and go to the air conditioning. And then you have the air conditioning on, and that causes the tear film to evaporate as well. And in the winter, it's reversed. It's really cold outside, your eyes start tearing when you go outside, I gotta go inside, and then you have the heat, and the heat causes more evaporation as well. So people with dry eye tend to get more symptoms in the summer and the winter. Stinging and burning of the eyes, again, very common symptoms. And anybody in this room read? Okay. I assume more people than that read, or anybody work at a computer? This seems like a pretty tech-savvy group, right? So when you're staring at a computer, you tend to blink less. If you blink less, there's more exposure with your eye open. So people will say, yeah, I'm working on the computer, and all of a sudden I just have to stop. After 10 or 15 minutes, I feel really fatigued, and that's what's happening. Your tear film is evaporating. So what are the other symptoms of dry eye? This one, a lot of people say, you gotta be kidding me. Tearing, how could I have tearing if I have dry eye? That makes no sense. Where did you get your diploma, right? So why do you get excessive tearing? Remember I said there are two systems that produce tears. One is the basal, which is a little bit all the time. The other is a reactive. So the body is pretty smart, and if you're listening to me and you're really concentrating, your eyes are wide open, after a while your tear film evaporates and you say, okay, I gotta call in the reserves, and you sort of get a reactive and you get a gush of tears. So excessive tearing can also be caused by blockage in some of the tearing system, but frequently it's associated with dry eye. Another surprising symptom is blurred vision. People say, yeah, I was sitting at Dr. Stark's lecture, and all of a sudden everything went blurry. And they said, oh my God, I better call 911. And well, not necessarily. Because what happens is the tear film, if you don't have an adequate tear film, then your vision's not going to be consistently clear. So if I took a healthy 16-year-old, which would be a cruel thing to do, and I took a hair dryer and I just whisked it over their eyes, they wouldn't be able to tell the difference between me and anybody else in this room. They'd be so blurred. So the tear film is the most important part of the eye in terms of clarity of vision, because it's the first surface that interacts between the environment and the internal part of the eye. So you can have beautiful cataract surgery, you can have healthy retinas, but if your tear film is deficient, things are going to get blurry. And patients will say, yeah, I get blurred, and if I blink a couple of times, it seems to clear up. So when they blink, what are they doing? They're spreading the tears more evenly, or they're causing extra tears to be produced when they squeeze some of the glands around the eyelid. So blurred vision is a very common symptom, and sometimes people will come in for emergency saying, yeah, I woke up and my vision was really blurred for like 15, 20 minutes in the morning. And then I called my doctor, I called my children, and they said, you better get to the doctor right away. So, and it was just really dry eye. So that's the other surprising thing. Why would you get blurred vision in the morning when you've been sleeping all night and your eyelids are closed? Anybody have any ideas how that could happen? Well, what happens when we sleep? Most of our functions are very low capacity and low production, so we're not producing a lot of tears when we're sleeping. So when we get up in the morning, it's like it's a shock to our systems. So we'll talk about what we do. So that's another frequent complaint. People say, yeah, it takes me 10 or 15 minutes to get my vision back when I get up in the morning. So I just stay in bed till it seems to clear up. So those are some things that most people find surprising about dry eye and might not have known.